So, in the previous class, Madam has already discussed about RBC, right? So, shall I ask one question on this RBC? Huh? As you already know that, so what's the count of RBC and what happens if RBC count will get decreased? If what happens a sudden increase in that, more number of increase in RBC means what will happen? So if decrease in count, that is also disease condition. If sudden increases, that is also disease condition. If reducing the erythrocytic count, so that may lead to a disease condition called erythrocytopenia, or we can also call it as anemia. So when we will call it as anemia, so when the person will be having less HB in his or her blood, so then only we'll call it as anemic. Anemic is related to count of RBC also. So where that hemoglobin is located at the center of this biconcave shaped RBC. So if hemoglobin content space is more in RBC, so that acupoint takes place. Before maturation of RBC, we have nucleated RBC. So that nucleated RBC, when they will undergo maturation, so that whatever Golgi apparatus, ribosomes, endoplasmic reticulum is there in the center within that cytoplasm of RBC, that will get dissolved, completely disappears, that is to be replaced or occupied by hemoglobin. That's what we called as a respiratory pigment. So that respiratory pigment is very important for carrying of the oxygen or for the carrying of this carbon dioxide. So when we will inhale the air, so that what exactly that oxygen, so oxygen usually is there in the atmospheric air. So that atmospheric air, when we will inhale through all the respiratory passage, it may ultimately reaches to the alveoli. As you already know, alveoli are the structural and functional units of the lungs. So where it will get diffused. So after that directly it reaches to blood. So where hemoglobin is there in RBC, within that blood only. Is it or not? So when that oxygen will diffuse from alveoli, it reaches to blood by diffusion process and binds with that RBC, especially hemoglobin, it forms oxyhemoglobin. Oxy means oxygen plus hemoglobin present in RBC. Oxy plus hemoglobin, oxyhemoglobin. This is what you have to remember always. When hemoglobin will binds with this oxygen, it is a reversible process. It forms as HbO2. Are you getting my point? While coming, when we will inhale air, this is binding with this oxygen hemoglobin present in RBC. So that will circulate in the form of oxyhemoglobin from where? From lungs to different parts of the body. So how it will dissociate again? It has to once again dissociate now. If dissociation only not there means this is always in the form of HbO2 only. If HbO2 form means no use then, will not get tissues will not get the oxygen supply. So how then? So what will happen? Dissociation takes place. Again separation takes place. Once again HbO2 will convert into Hb plus of O2. Then O2 will get utilized by the cells. Again there also diffusion and Hb once again retains as it is in that RBC only. So that is what. So we are getting the oxygen supply. That's what we are. Normal metabolic rate is going on in us. If deficiency of oxygen, for example, you can take if you are in a dark room without this any ventilation means immediately will start suffering from this difficulty in breathing. Is it or not? Otherwise 1 or 2 minutes immediately you close this both mouth and nostrils. What will happen immediately after opening them? You will start suffering from excessive breathing, inhalation, deep exhalation. So why? Because of that all depends on this content of hemoglobin. Is it or not? So for that hemoglobin or respiratory pigment or overall erythrocyte is very important. So due to that type of erythrocytes are there or enucleated, absence of nucleus, instead of nucleus at the center you are finding hemoglobin is there. So this is what, how essential is it? Is it or not? So RBC will be involved in transport of gases especially. So when you go to higher altitude, you know higher altitude. So like a space in stratosphere somewhere. So their deficiency of oxygen is there. So what immediately? Person, they don't have this artificial ventilation means immediately they will start suffering from breathing difficulty. Is it or not? So what will happen at that time? Immediate increase in the RBC counts. If we are suffering from altitude sickness, are you getting my point? So how that immediately RBC count will get increased when we will be in space? How we will not suffer from this difficulty in breathing immediately means by sudden increase in the erythrocytic count, RBC count. How it will increase? By release of a hormone called erythropoietin. So erythropoietin is a hormone kidney, so that is to be secreted from kidney. So this kidney, when it will secrete, when we are suffering from altitude sickness, when we are suffering from difficulty in breathing, immediately release of this hormone into the blood. So through blood, it may reach us to the target organ. Where is the target organ here? Bone marrow. So when it reaches bone marrow, it will start triggering to increase more number of RBC than normal. Are you getting my point? So in 1 second usually, so 1 to 2 millions of RBCs are to be producing normal in the bone marrow. Are you getting my point? 2 millions per second. So like that, it will become doubled. So when we are suffering from this. So this is what the role of erythropoietin whenever we have less count of this erythrocyte, especially when we are in the higher altitude. Another best important thing about this RBC means you should remember that what is meant by this blood doping. You have heard this word blood doping usually in athletics, na? So they will go for this blood doping. So usually in this drug case, how this to be going on, na? If she took or not, they will go for one test. So like that only here also in athletics, na? To increase their stamina. Immediately like Usain Bolt. So how they will increase immediately, how they will move very faster without this lactic acid formation immediately. So usually normal person without this blood doping injection, if we run 100 meter, na, immediately will start suffering from this muscle fatigueness. Will start suffering from this pain. Achness will be there in that particular region, but not in this case. So what will happen? By taking immediate blood doping injection will be there. So by taking that immediately this will also trigger so double or tripling in that RBC count. If RBC count, how this will go on increases, na? Like that only we will get a more oxygen absorbing capacity from atmosphere. We'll start more inhaling. It means that if RBCs are more in our body, will become more stronger, will have this more stamina. Why? Because it will get more bind with that, more erythrocytes, more binding of oxygen, more binding of oxygen, more metabolic activity. So that's what immediately will get the stamina. So this is what we call as blood doping. Usually, so why that person will suffer from this anemia or this erythrocytic problem? So that there are majorly different types of, more than 400 types of anemia are there. So out of 400 anemia, so the common type of anemia is majorly caused due to 3 reasons to be there. Why we will suffer from weakness? Is it or not? So one majorly due to blood loss. If person will undergo injury, an accident will happen means immediately what will happen? Hemorrhage takes place or excessive blood loss takes place. If excessive blood loss will be there means immediately he will become weakened. He will go to sometime home also then. Is it or not? So first thing will be blood loss. So from that also the person will start suffering from this anemia. And second most reason when we will start suffering from this anemia means when there is a decrease in erythrocyte counts. When erythrocyte count decreases. When erythrocyte count decreases, then also the person will start suffering from slowly weakness or anemic. That is nothing but a decrease in RBC count, of course decrease in HB also. Is it or not? What's that normal HB range? 12 to 16 mg per 100 ml of blood. We should have normally in males and females that may differ. Usually in female, so you will find that less HB than boys. Usually males will be having more HB than female. So why? Because of when attains maturity, so there is a loss of blood takes place due to this menstruation. So due to that reason, so that there is a little decrease in HB. So then in males. Usually male stamina will be more, that's directly influenced by this more count of RBC and more HB also. Are you getting my point? So in that way only, this is another thing when we are suffering from decreased count of RBC, that also leads to anemia. And third, one more reason will be that. What is that reason? Less HB in blood. Less HB in blood may also cause this anemia. So all these are the three different reasons why the person will become anemic. So one common type of anemia is called a hemolytic anemia. Hemolytic anemia means heme means blood, lytic means breakdown. If more breakdown of RBC will be there means more breakdown of RBC will take place where? In spleen. That's what the spleen we called as graveyard, smashan of RBC. So why we are calling? Due to this breakdown of RBC will be there. So after 120 days, after completion of that 120 days, so they will directly go to smashan only. Is it or not? So that's what we call it as graveyard of RBC. So or we can also call it as a spleen as we can call it as graveyards, or another word we can also use it as a blood bank. Blood bank. Why we are calling it as blood bank? If any erythrocytes, excess erythrocytes are there, if they have not completed this 120 days means they are still like alive only. So they are in mature stage only. So such type of what will happen? So those will get also stored in this type of blood bank called a spleen. Usually you can take spleen structure. This will be having two pulps are there. So one side is called a red pulp. Not that pulp. Some of the Mosambik pulp is different, this pulp is different. So this is called a white pulp. So here two pulps you will find in this. So in red pulp, so while filtration is going on, so here blood is coming. So whatever warming out of this RBCs are there, breaking out of RBCs and the WBCs, the time over means WBC will also undergo breakdown. If WBC will be excess means, so those excess WBC will get stored in this white pulp. Red pulp, if erythrocyte still lifespan is there, how we have this 60-year lifespan nowadays. So if we have lifespan still, so we will not move towards that. If we move, so then only we will stay. So like I told you here, little lifespan is there, so this RBC will get stored for the future use. Are you getting my point? Once again, if we are suffering from erythrocytic count less, so that once again through this red pulp once again reaches to the blood circulation process. This is how the red pulp and white pulp you will find. So that's what it will act as a both blood bank as well as graveyard of RBC. So this is overall information about this RBC, and later remaining information also we have collected. So what is meant by polycythemic condition and all. You have heard that word polycythemia. So polycythemia when we will call, so sudden increase in the RBC count. Suddenly increases means that this is condition. So why I have already told you that if RBC will be increasing means I have already told you now only stamina will increase. Is it or not? So why it will cause disease, sir? You will ask them. Is it or not? So if anything happens more than the normal level, that will cause us something. Is it or not? Like that only here in RBC also. If RBC will be goes on increasing means if polycythemic condition is there, the person's blood will goes on increase its thickness. If blood thickness will increase, what will happen? Viscosity will increase. If viscosity will increase, it may have a chance of heart attack or any heart related problems, or blood clot may take place. Is it or not? So that's what will happen. So this is more RBC will also a problem and less RBC will also a problem. So that's what we should have on average count of this RBC, that is nothing but in between 4.5 to 5.5 millions per cubic mm of blood. So this is what the normal count. Usually in females this may lesser, little 1 or 2 million lesser than this man. Right? So this is overall information about this RBC which I already gave, and later we'll start with this WBC. What we call WBC. You can write it as WBC, WBCs, or we can also call it as leukocytes. The name itself says leukos means white or colorless. How erythros means red, na? Like they told here, leukos means colorless or whitish. Cytos means cells. That's what we are calling it as white cells. WBCs are white only, na? Colorless only. Why? Because what is not there here? Absence of respiratory pigment called a hemoglobin. Hemoglobin is not there. That's understood. So another very important thing about this WBC. So WBCs, when you come across RBCs are the more number of blood cells in the whole body fluids. So like that only second largest number of these cells within that body fluid means WBCs only. Usually we will find 6,000 to 8,000. This will be not a constant in all person, or in that same person only. It may differ when you will count the first one day, later after second day again it may differ. Why? Because these WBCs are like soldiers in our body, in our border. So soldier count will be non-persistent. It may changes, go on changes. If someone will come, so they will start fighting. So some people may get reduced. Why? Because of this bomb attack and all. Again, will some people will join to Navy or somewhere. So once again they will reach us to border, and once again they will protect us. So like that only in our body also we have soldiers. So if anything, any foreign particle will come, like any bacteria, virus or anything, what will happen? Immediately, so these cells will start the fighting against that, and thereby some WBC may undergo death, some will remain. Is it or not? So their count may get once again reduced. Some other any disease condition is there, so rapid increase in the WBC also takes place, how it is there in RBC. Are you getting my point? So 3 words you have to remember. Total 9 words may come. What are those we'll discuss now. So cubic per cubic mm of blood. Usually 6,000 to 8,000 per cubic mm of blood you will find. This is normal count. Lesser will also cause disease here, more will also cause disease. So what that count will matter here? So less count of WBC may cause a disease called leukopenia. 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 Then erythropenia or erythrocytopenia. Here also leukopenia or leukocytopenia. This is common. If the person is suffering from less count of WBC. So when a less count of WBC takes place, that's understood that the person is suffering from infection. Are you getting my point? So whenever the person is suffering from viral infection, any viral infection including coronavirus also, viral infection or any other diseases like a protozoal infection like malaria, or if the person is suffering from bacterial infection like a typhoid. Typhoid is caused by Salmonella typhi. This is a causative agent. In these conditions, our WBC count may get decreased. In some other conditions, what will happen? Increased count. Increased count of WBC. That is also disease condition, not normal. So I have more count of WBC means that will lead to a dangerous disease condition. So that is also danger. That disease condition is called leukocytosis. There we call it as polycythemia. Polycythemia, or we can also call it as their erythrocytosis. There 3 words, here 3 words. Now 2 over, 1 more is remaining. Pyosis. Hemopyosis, formation of blood in bone marrow. Erythropyosis. Pyosis means a suffix as a formation. Is it or not? Erythros means prefix red blood cell. Pyosis means formation. Erythropyosis. Here what is that? Leukopoiesis. Understood that? Is it or not? These are medical terms you should remember if you are going for this medicine or any other medical courses, right? So you have to. So leukocytosis, if there is a sudden increase in the WBC count in our body. So how we will come to know if this is in decreased state or increased state? Whenever infection may come, when you will go for this count of WBC, doctor will tell hyper or hypo. If hypo condition, that's understood that we are suffering from viral infection or malaria or typhoid. If increased count is going on, so any other bacterial, especially peculiarly bacterial infection. So their count may go on increase, like including TB also, tuberculosis or any other bacterial infection. Are you getting my point? So increased count of WBC we call as leukocytosis, especially when the person is suffering from acute. Acute means what? Short time. Chronic means long time. We'll call it as now. So chronic bronchitis, acute bronchitis. Due to pollution, we may start suffering from difficulty in breathing. What I suffered previously, acute bronchitis. This is common, but this is not that much serious. Acute. So like that here also, acute bacterial infection. Acute bacterial infection. If the person is suffering from any acute bacterial infection, in that condition, sudden increase in the WBC count takes place. This is what leukocytosis. More number also causing problem, less number also causing problem there. So less number means soldiers will become less. What will happen? We may become very susceptible to the disease. We may get any type of disease, including from rhinovirus to including this AIDS also. Is it or not? So AIDS will also influence on our immune system only. In our body, specific lymphocytes will come. So today we will discuss about that. Specific lymphocytes are there in our body. So those lymphocytic count may get decreased due to this viral infection called HIV. Is it or not? So all these are majorly caused due to less soldiers in our body. Sir, if soldier count is going on increasing continuously, means that is good only, sir. So our body will become very perfect. So that will also matter. Is it or not? Increasing or decreasing will also matter. So that will, as well in the next sentence, if rapid, or we can call it as abnormal increase in WBC. This is sudden due to bacterial infection. This is due to directly influencing on that bone marrow only. Abnormality occurs in that bone marrow means the WBC production may continuously go on increase. The disease condition is called leukemia. You heard that word leukemia? Blood cancer. We can call it as blood cancer. So why that blood cancer may cause it? That is also due to infection, or that is also abnormal function of this bone marrow. Is it or not? So many different reasons to be there why that person may suffer from this leukemia. Have you seen it? So hair fall will be there, so they will be bald, like that they will show in advertisements and all that. So that is a very dangerous type of cancer amongst the out of 5-6 types of cancers. So usually lymphoma will come, sarcoma will come, carcinoma will come, leukemia will come. Like that, 5 different types of cancerous types are there. Out of 5, this is very dangerous. So, like that, how that person will suffer means by abnormal increase in count of WBC. So, this is what you have to remember: abnormal count, normal count, or less count. And what is the formation of WBC in bone marrow? We call as leukopoiesis. Leukopoiesis, leukopoiesis. Formation of WBC in bone marrow. One more thing about RBC, when you compare with this WBC, you should remember. What is that? Why that anemia will come specially? Why that hemoglobin content will get reduced in our body. Means you have seen or not, usually doctors may give iron injections. What's there in that exactly? Iron injection means iron content will be there. Why? Because that respiratory pigment will have this iron content only. Along with that, how to increase that content normally, how to increase that HB means we should not especially suffer from this two vitamin deficiency. So one is called vitamin B9 and vitamin B12. If we are suffering from this vitamin B12 or B9 means B9 we can call it as folic acid. You heard this called folate or folic acid. This is vitamin B9. If you are suffering from anemia or weakness, so first, so they will, doctors will suggest either you have to take this vitamin deficiency tablet, or especially doctors will suggest this vitamin B12 tablets. B12 we can also call it as cobalamine, or we can also call it as methylcobalamine. In the deficiency of these two vitamins may cause anemia or less hemoglobin in our blood, especially in RBC. Then only we'll start suffering from anemia. Are you getting my point? So this is one thing. And like that only here also, sometimes less count of WBC. That is also majorly caused due to vitamin B9 deficiency. This vitamin B9 deficiency or folic acid or folate deficiency also cause less production of WBC in the bone marrow. Are you getting my point? Less production of WBC in the bone marrow, that is caused due to vitamin B9, or we can call it as a folic acid deficiency. Deficiency of folic acid. So this is one thing about WBC. And another very interesting thing you should remember. So WBCs are lesser in number than RBC and more in number than platelets. This thing is also very important. And one more important thing you have to remember, when you come across the ratio, you can consider RBC, WBC. In our blood, if you count in 1 ml or something, 600 RBCs are there, means out of that 1 WBC will find. Are you getting my point? You can take amount of blood in that ratio, you have to know. 600 RBCs are there means 1 WBC. It means that that's what less count of WBC in human blood or body fluid than that of this RBC. RBC count is more. Are you getting my point? The ratio is very important, you should remember. 600 is to 1. And one more important thing, when you come across the shape, what is that shape of RBC means? What will tell? Biconcave in shape. Is it or not? So biconcave means I can draw like this. Is this correct according to physics? Biconcave. Concavity is there both sides. Usually biconcave in side view. Side view, this will be looking like. Or you can take like this, one above the other. This will look like this, a spherical in shape. In one angle like this or in other angle like this. Usually the shape will be biconcave in shape. So this is to be arranged one above the other, like how the piles of coins you will find one above the other in similar way. Like it only when you come across shape of WBC. WBC will have amoeboidal in shape. Amoeboid shape. Amoeboid in the sense like this. It is a type of WBC we call as macrophage. You heard this word macrophage? In our body, in our tissues, Any foreign particle like Pakistani people will come in immediately. So this is in a different form. It may get a change into like this amoeba-like structure. It will enter into tissue from blood into tissue, and thereby wherever that foreign particles are there surrounding tissue, na, it may get undergo fighting action, and finally it will undergo engulfing action. Are you getting my point? So this is what we call as this will have amoeboidal in shape. WBC may change its shape according to that foreign particle where it will be. So this is what shape. And one more thing you have to remember that what is mean by diapadasis. Diapadasis in the sense WBC is squeeze out from blood capillaries. Squeeze out from blood capillaries into the tissue spaces. Are you getting this sentence? Very easy. If you take this is a blood vessel or blood capillary. So within that blood capillary, what is flowing? Blood is flowing, is it or not? So within that, what you are finding? RBCs are there, WBCs are there, platelet is there, and plasma will be there. So for example, you can take here we are discussing about diapadasis. In the diapadasis, what will happen? Normally blood is flowing, WB soldiers are within the blood, is it or not? So what will happen here? Tissue space. This is tissue. In between tissue space you will find. Here any foreign particle has entered here. What will happen here? From here, WBC will undergo diapadasis. Diapadasis entry from blood through this blood capillary into the tissue space. This is what we called as diapadasis. When the diapadasis takes place from, it will come out from the blood capillary and it may reach us to the tissue space. Here foreign antigens you will find. So it will start fighting against this foreign antigen and thereby it will completely engulf by this macrophage. When this is to be in a blood, we call as monocytes. When it reaches to the tissue space, it may get converted into macrophage. Can I get my point? That's what I have written as macrophage will be having amoeba-like structure. When it coming out of this blood capillary by undergoing a process called diapadasis. Are you getting my point? This is what very important phenomenon about this WBC by undergoing this diapadasis, engulfing of the foreign particle if it is to be there, in tissue space. Are you getting my point? This is one line information about this shape and diapadasis. Then come across the size. What's that normal size of RBC? RBC size? Size of the, let it be RBC over, then WBC you can take 12 to 20. What is this one? I don't know. Myometer, millimeter, micrometer. 10 raised to minus 6 means micro. Is it or not? Milli means 10 raised to minus 3. 10 raised to minus 6 means micrometer. So this will be having size of WBC. Size of RBC means 0.8. Actually, you should write it as 0.7. So 0.7 how will convert in this micrometer? 7 micrometer. 7 micrometer. 7 to 8. Normally 7 to 8 you will find, but this is to be larger compared to RBC. Size larger, not in number. In number only 6,000 to 8,000. There 4.5 to 5.5 millions per cubic mm of blood. Is it or not? So this is what size. So then followed by Types of WBC. And one more important point you have to remember here, if you are going for in future, if you are going for any lab test means doctors, if you are suffering, you are looking like weak and fever will be there means they will go for some test. So that erythrocytic test, that is different. About this WBC test means they will go for TLC. You heard this word TLC? TLC stands for total leukocyte count. Total leukocyte count in the sense they will count that in 1 cubic mm of blood how much these WBC cells are there. They will total number of WBC count they will count in that machine, that is by undergoing this TLC. If you are specific to that particular type of WBC, I'll go to that types of WBC now. So different types of WBC may come. In that one of the WBC type, I'll call it as lymphocytes, or I can call it as a basophil. If the person is suffering from sudden increase in the basophilic count continuously, means that shows that the person is suffering from cancerous condition. Doctors, they will go for directly, they will not go for biopsy. Biopsy is a cancer test. So before that, they will first observe in that differential count. First they will go for differential leukocyte count, DLC. If they want to know how much lymphocytes are there in total WBC counter, how much basophils are there in the total WBC counter, how much monocytes are there in the total WBC count. Differential in the sense a single count. TLC means total count, total number of WBC in that given amount of this blood. Getting my point? If you are suffering from any infection, they will go for TLC or they will go for DLC. In depth means DLC. Individual, they want this data. Have you seen or not? Complete this medical report they will give in that lab technician they may give. In that they will write DLC, eosinophilic count, basophilic count, neutrophilic count. So like that means differential leukocytic count. Right? This is what you have to know. The next types of WBC, you write it down as what happened? First one, granulocytes. Granulocytes. So what it means? In the sense absence. Granules. What granules? Cytoplasmic granules. Usually when I take any type of WBC, what is there in WBC? What is there in RBC? Central space occupied by hemoglobin, surrounded by cytoplasm will be there. Like that only here also, occupied by instead of hemoglobin, nucleus will be there. Their nucleus is not there. So here occupied by nucleus, then remaining part will be cytoplasm. Within that cytoplasm, small proteinaceous granular structures are there, means we call it as WBCs are granulocytes. These cytoplasmic granules are not there, only cytoplasm is there, means granulocytes. Are you getting my point? On what basis we call the two different types of WBCs? Granulocytes, absence of cytoplasmic granules. You have already taken one chart in that you have drawn everything. So WBC count two different types and all. In that you write it down separately starting from granulocytes. Granulocytes are of mainly two types. What are those? First one is called lymphocytes. Second one, monocytes. So I will take one line information about monocytes. For example, you only think that I'm a lab technician. All WBC cells are colorless. How we will come to know this only lymphocyte, this only monocyte, and this only this acidophil, basophil, or something? How we will come to know? You cannot differentiate. All are whitish in color. Is it or not? So that's what certain type of granulocytic count na, they will go for some staining techniques. When you will come across granulocyte na, I'll tell what are different types of stain they will use for this. So these cytoplasmic granules are there na, in cytoplasm. They will absorb that type of stain. When they will absorb that type of stain, remaining all cells will look like white. Why? Because they won't absorb that type of stain. But only these cells, which cells we want to calculate now, so those cells only, they will have this ability to absorb that type of stain. So then remaining all will look like a white, only these will look like a color. We can easily identify in one, is it or not? In one square, how much this number will be there in total WBC count. Are you getting my point or not? This is very easy. So that's not granulocytes and granulocytes. Monocyte is one of the granulocyte. When you come across shape of monocyte, when you come to higher in medicine and all, you will come to know practically so how to calculate and all this, right? So this is a spherical in shape. Cell will be spherical in shape, and nucleus at the center we will find nucleus will be looks like a kidney shape or bean shaped nucleus. This is very important for your exam point of view. What is that shape of the nucleus in monocytes? And surrounded by cytoplasm. Here granules are there. Granules are there? No. Why? Because this is a type of granulocyte. We are using any stain here? No. Right? So, how we will come to know this only? By the shape of the nucleus. Looking like a bean shape, or you can write it as shape of nucleus. In that hyphen I write bean or kidney shape. Bean or kidney shape nucleus will find. And second one, come across very important thing. So these are motile and phagocytic. Motile and phagocytic in nature. What it means? Motile means they can move. I have already told you diapedastis is there. Movement is there. Then phagocytic means they have this ability to engulf. Are you getting my point? Engulfing process. Two types of engulfing process will come. Phagocytosis, pinocytosis. Pinocytosis is nothing but a cell drinking. How will drink water? Like it only these will undergo direct drinking. Engulfing process is called phagocytosis. Are you getting my point? Two different types. Pinocytosis. This is cell drinking, this is cell eating. Cytosis, engulfing process. So phagocytic and highly motile in nature. Then one more very important thing about this monocyte. I have already told you that these monocytes may undergo dipedasis. Are you getting my point? So these will have highly phagocytic in nature. Then last point, how much percentage in total WBC counts? In 100% of this WBC means what about this contribution to that total leukocytes? How much? 6 to 8%. So this is not a pakka percentage. It may range, it may vary continuously. Why? Because how this RBC will have 120 days after that they will die in that graveyard. So, but not here graveyard. Why? Because throughout the body blood circulation is there, and throughout the body, so soldiers to be moving here and there. So wherever foreign particle will come, foreign agent or antigen will be very stronger than these type of WBC means what will happen? These may die, these people may die, they'll get more strength again in our body, that's what will become very susceptible. Are you getting my point? But instead of that, these are very strong, those people will become very weak means these will start fighting on them. So these will become very stronger. So that's what these will not have a have proper lifespan. In border also they have proper lifespan. You may give that, hey, will live 60 years like that. You will tell her. You will tell her. Soldiers means what will happen every minute is very important for them. What will happen they only don't know. Is it or not? From back side, from front side, or from upside, in any way. Like that only here also. Normally lifespan when you come across overall WBC 1 to 2 weeks. They have 1 to 2 weeks. Normally 1 to 2 weeks, after that they'll die. Is it or not? So they will dissolve in that lymphatic system, not in spleen. Lymphatic system. Do you know what about lymphatic system means? No, later we'll discuss about that. So first you should know this percentage is very important. Lymphocytes. Then followed by another granulocytes. After completion of this monocyte will be lymphocytes. When you come across shape of the lymphocyte, this will also look like spherical, but shape will also have this spherical or rounded in shape. You are easily differentiating the shape of the nucleus and here shape of the nucleus. So you write it down, shape of the nucleus is spherical. Spherical shaped nucleus. Spherical shaped nucleus. And second, the percentage is also very important. How much percentage? 22. You should always go according to NCERT. Actually, according to medicine book, if you want to study this medicine physiology book means, yeah, this may a lot of changes are there. But for your this neat point of view, actually only 20 to 25%. The actual percentage will be 20 to 40%. Don't get confused. Normally, I am telling that 20 to 25 according to NCERT. This is enough to you. When you come to this medicine, you can easily come to know how it may vary. What's the percentage? Then followed by one more very important thing about lymphocyte. So lymphocytes are non-motile. Non-motile and non-phagocytic. Non-motile and non-phagocytic. They will not undergo any fighting, but it will be involved in maintenance of this normal immune system. You heard that word immune system? Huh? Immune system in the sense, if we are strong means, doctor will tell, hey, your immune system will be very strong. It means that internal environment. Homeostasis will be good or metabolic activity is good. All metabolic activity is good, so our immune system will be good. If any disturbance is there in our system, that is majorly caused due to any bacteria or any foreign agent, doctor will tell that your immune system will get weakened. Is it or not? They will prescribe different antibiotics and all that. Is it or not? For bacterial infection, they will go for this antibiotics, erythromycin. Is it or not? So like that they will give. So that's all based on your immunity. So here lymphocytes are of majorly present in two groups. Always lymphocytes exist in two groups. Lymphocytes exist in two groups. Correct. So first one is called T lymphocytes. Second one, B lymphocytes. This is what very important existing forms of this lymphocytes. Second one, B lymphocytes. On what basis we are calling it as? Should we stop here? 5 minutes. We will discuss in the next class. Thank you.